Spinal muscular atrophy, also known as SMA, by Jameer Wright. What is SMA? SMA is a genetic disease affecting the motor neurons in the spinal cord and impacting muscle movement. There are three major different types of SMA: type 1, type 2, and type 3. Let's start with type 1. This is the most severe form of SMA, with onset typically occurring within the first few months of life. Babies with type 1 SMA usually have very weak muscles, poor muscle tone, feeding and swallowing difficulties, respiratory issues, and difficulties controlling head movements. Next, let's go to type 2. Children with type 2 SMA usually have moderate to severe muscle weakness and have delays in motor milestones such as sitting up independently. While some children with SMA type 2 can achieve the ability to sit up without support, they may have difficulty standing or walking without assistance. And last but not least, type 3. Type 3 typically has a later onset with symptoms appearing after 18 months of age and sometimes not until adolescent or adulthood. Individuals with SMA type 3 usually have milder symptoms compared to type 1 and type 2. They may experience muscle weakness, difficulty walking, frequent falls, and fatigue. Some individuals with SMA type 3 may be able to walk independently for some time, although they may need assistance eventually with things such as braces, walkers, or wheelchairs. Why I chose SMA? This guy right here, Peter Hankel. Peter Hankel was son to Allison and Tim Hankel, along with being brothers to Chris, Lucy, and Ian Hankel. Pete was in 8th grade before passing away. Even though he had SMA, that didn't stop him from living a very physically active life. Cure SMA night. This night was made very special. Pete was one of the wrestling captains for our Radnor wrestling team, and after passing away, we made a special night dedicated just to him and SMA in general. During that night, we give out information about SMA and honor Pete. Next, we have the SMA Walk. This is also another event that's held around June for SMA. Cure SMA is the foundation that runs this, and it is made for people with SMA to come out, enjoy activities, and even be paid for people without SMA to come out and learn more about SMA. Next, let's go into gene therapy. There is no cure for SMA as of now. However, there are several treatment options that aim to manage symptoms, improve motor functions, and slow disease progression. In May 2019, Zolgensma was approved by the SMA. Sorry if I'm pronouncing that wrong. Zolgensma is a gene therapy that develops a functional copy of the SMN1 gene to motor neurons, increasing SMN protein production. It is administered as a one-time intravenous infusion and has been shown to improve motor milestones and survival in infants with SMA. Clinical trials. START was a phase 1 2-year program that enrolled 15 patients with type 1 SMA to take Zolgensma. As you can see by the chart, most of the results were positive. Before, with the natural history, most of the patients weren't able to do any of these activities alone. After the medication, 92% were able to have maximal head control, 75% were able to roll from their backs to their sides, and then 92% were able to sit without support for 5 seconds. The list goes on. Response to exercise. Individuals with SMA often have significant muscle weakness, which can lead to fatigue during physical activity. This may have difficulty performing certain exercises or may require modifications to accommodate their level of strength. Physical therapy is an essential component of SMA management. So when I'm making this exercise prescription, I'm going to make it more through a physical therapy side more than strength and exercise training. The reason I'm doing that is because a physical therapist can develop a tailored exercise program that focuses on maintaining muscle strength, range of motion, and functional mobility while minimizing fatigue and risk to injury. My client, my client's age 11, has medical history as type 2 SMA, has taken Zolgensma as a child. He's currently participating in a wheelchair hockey league that keeps him a little bit physically active on the weekends. Some of his goals are to be able to move to the best of his capability. He likes sports like hockey, football, and soccer. He also likes spending time with friends along with aquatic activities. And some of his dislikes are stairs, hence why we always take the ramp, and prolonged physical activity. Expanded Hammersmith testing. What is this? The expanded Hammersmith functional motor scale includes additional items and scoring criteria to provide more comprehensive assessments of motor functions, particularly for individuals with SMA. It evaluates a range of motor skills, including head control, sitting, standing, walking, and upper and lower limb functions. For my exercise testing, I decided to pick 3 of these tests that could be done with my client. First test we decided to do was the long sitting test. It's where we test if the patient can sitting up without using their hands or without having their legs roll out to the side. The next test I decided to do was the roll supine to prone. This test sees if the individual can roll from their back to their stomach in both directions without using their hands. Last but not least, I decided to do the props or forearms test to see if my patient can hold themselves up with their forearms for a count of 3 seconds. For aerobic exercises, we started with aquatherapy. Assisted aquatic aerobic training allows my client to engage in cardiovascular exercise without putting excessive strain on the body. Frequency should be around 3 to 4 times a week. Intensity should focus on comfortable movements and avoiding overexhaustion. And intensity should be adjusted based on an individual's tolerance level and ability. Time should be around 20 to 30 minutes per session. Next, for resistance training, we go to the sling and spring. Sling and spring devices are intended to improve independence and function in individuals with SMA by providing support and assistance with upper and lower body extremity movement. Frequency should be around 2 times per week. Intensity should be very low to low, focusing on gentle movements and going in intervals to avoid fatigue or strain. Reps should be 12 to 15 with sets of 2. Exercises should include shoulder press, curls, bicep curls, arm extensions, along with leg extensions, hamstring curls, and exercises like that. Last but not least, let's go to assisted stretching. She'll perform a series of static stretching that targets all major muscle groups. Each stretch should be held for at least 15 to 30 seconds, repeating 2 to 3 times. Should be focusing on areas of tightness or limited range of motion, such as the hamstrings, hip flexors, chest, and shoulders. Using the sling and spring device for support or assistance with stretching as needed. Last but not least, let's go over modifications and special recommendations. Because of the muscle fatigue onset that happens earlier, individuals with SMA may need to pace themselves during exercise and take frequent breaks to prevent overexhaustions and fatigue. It's important to listen to the body signals when they're working out to see when rest is needed. And then exercise should be enjoyable and engaging for individuals with SMA. So participating in group activities can provide socialization opportunities and motivation to stay active. Here are some useful links that I had. Thank you for listening.